The Health Secretary, Matt Hancock, has acknowledged the pain and suffering of victims of the Contaminated Blood scandal, saying the government will pay compensation if that is what is recommended. He was facing questions at a public inquiry into what's been called the worst NHS treatment disaster. Around 3,000 people died after being given blood products containing HIV and hepatitis C in the 1970s and 1980s. Here's our health editor, Hugh Pym.
I've now faced the fact that I will never see him again on this earth. His last words were, and repeatedly, that those who did this must be brought to repent.
Sue remembers her husband Steve as she visits his grave in Devon. He was a haemophiliac who was treated by the NHS with contaminated blood products in the 1970s and 80s. He developed hepatitis C, a debilitating illness. It meant they couldn't have children. Steve died in 2018.
This is just wonderful, and it's a superb place to come and visit the grave. If visiting the grave is about spiritual refreshment and about just finding peace and being together.
Sue, like many others who were bereaved, wanted to hear from the Health Secretary today a firm commitment to financial compensation.
I'm hoping that he's going to actually apologise, to admit that there is now enough evidence for them to stop denying that proper compensation should be paid, and not as a financial gesture, but as a gesture of contrition.
Sue travelled to London to be at the latest hearing of the public inquiry into what's been called the worst treatment disaster in the history of the NHS. Tens of thousands were infected by blood products carrying HIV and hepatitis C.
The whole truth.
And nothing about
Matt Hancock said he understood what families had endured.
I acknowledge the pain and the suffering, not only of the errors that led to this harm on people's lives, but also a sense that redress wasn't properly considered, and that people felt their voices weren't heard.
And then to the crucial issue of compensation.
I respect the process of the inquiry, and I will respect its recommendations, and should the inquiry's recommendations point to compensation, then of course we will pay compensation.
For Sue that was significant, but she has reservations.
It's a huge move. But of course, if they actually decide to pay compensation, if they decide to hinge it on what the inquiry decides, that gives them another 2 years, 3 years, before they have to find a penny.
The inquiry will last for at least another year, so the long wait for official recognition of their losses will continue for a while yet. Hugh Pym, BBC News.